Namaste everyone. I'm Varsha, student of Srinivas Institute of Technology, here to share a small piece of information with all of you. Just imagine you have a normal day, you're walking down the street, and then this happens. Such an emergency situation these days, isn't it? What is the first thing that pops into your head right after? Obviously, the one and only, the talk of the town, COVID 19. Anybody, anywhere coughs or sneezes, the first thing that pops into your head right now is COVID. But not all cough is COVID 19. A few months back, the same cough, the same sneeze had 100 distinct infectious diseases explaining it. But now we seem to have only one. We need to remember that we had a life before the COVID 19 pandemic happened. There were diseases, infections, viruses even before that. There is much more than just COVID 19. We have common cold, whooping cough, tuberculosis, and whatnot. Now, here I would like to grab your attention towards tuberculosis. It is one of the world's oldest diseases. Almost one third of the world's population is affected by the disease. Fortunately, only a small percent of the affected evolved to be active tuberculosis. Tuberculosis in India is a major health problem, causing 220,000 deaths every year. What is tuberculosis? Tuberculosis is an infectious illness caused by airborne bacteria, Mycobacterium tuberculosis. TB can cause serious health problems, particularly if not caught early. Fortunately, the illness is curable if tested and treated sooner. What parts does it affect? Lungs or throat, being the pulmonary TB, kidney, brain, or bones, being extrapulmonary TB. We have different types of TB, being latent TB and active TB. If you have latent TB, you have TB bacteria in your body, but it is inactive. This means that you don't experience any symptoms. You also aren't contagious. Still, you will have a positive result from a TB blood and skin test. Latent TB can turn into active TB. This risk is higher for those with a weakened immune system due to medication or an underlying condition. Coming to the second type, active TB. It causes symptoms and is contagious, which vary depending on whether it is pulmonary or extrapulmonary. Active TB can be life-threatening if not treated properly and timely. This condition makes you fall sick, and in most cases you can spread it to others. It can occur weeks or years after the TB infection. How is it transmitted? Coughs or sneezes from a person affected from TB. When a person with TB in their lungs or throat coughs or sneezes, they send droplets into the air that contain the TB bacteria. If you breathe in these bacteria over a long time, you may become prone to TB. TB cannot be spread through touch, sharing cutlery, bedding, or clothes. Symptoms: cough for 3 weeks or longer, weight loss, loss of appetite, higher temperature or fever, night sweats, extreme tiredness, or loss of energy. In case of pulmonary TB, a person could also experience coughing up blood, coughing up phlegm. Now, coming to the treatment, one will need to have TB treatment for at least 6 months to make sure all the TB bacteria are killed. If one has TB of lungs or throat, after 2 weeks of treatment, you should no longer be infectious. Gradually, one will start to feel better. This may take weeks, but they will stop feeling sick and tired after the time. Even when you feel better, it's important to take the full course course of your treatment or you will become ill again. The below given are the antibiotics involved in the treatment. Treatment could vary according to the kind of TB, like if it is pulmonary or extrapulmonary, latent or active. We have something called drug-resistant TB. This can occur when the TB bacteria is resistant to the two most powerful antibiotics normally used to treat the illness. But fortunately, we do have treatment for drug-resistant TB, but the medicines used against it have a greater number of side effects and have to be taken for at least 18 months. People with drug-resistant TB are more likely to be admitted to the hospital for treatment and may be offered directly observed treatment. This is to help them keep taking the medications for as long as needed. Precautions to be taken if one has TB. Take all your medicines as they are prescribed until your doctor takes you off them. Always cover your mouth with a tissue when you cough or sneeze. Seal the tissue in a plastic bag, then throw it away. Wash your hands after coughing and sneezing. Don't visit other people and don't invite them to visit you. Stay home from work, school or other public places. Use a fan or open window to move around fresh air. Don't use public transport. Now let's compare the symptoms of COVID and TB. COVID has persistent cough, high fever and difficulty in breathing, while even in TB the person experiences cough, fever, also weight loss, loss of appetite, night sweats and extreme tiredness as mentioned earlier. Symptoms of COVID-19 usually appear quickly and disappear after about 7 days. If it lasts longer, please do contact your doctor. Symptoms of TB appear gradually over a course of several weeks or months and persist if they are not treated. Not every cough is COVID. Think TB. If you feel like you do have symptoms of TB, please do go contact your doctor and get tested. Thank you so much for bearing in with me till the end. I hope you have a takeaway from this video and please do share this with your loved ones. Thank you for watching the video till the end. Stay happy, stay safe, keep smiling. Thank you so much.